Dr. Lance Mabry asked a great question on LinkedIn, and I thought we should talk about it. I'll share a link to that question in the description of this video, but I'm going to read the question and then we'll discuss the topic. Question to business owners: can copay be variable, or can there be a premium service payment? Essentially, could you bill more to the patient to be seen by an expert therapist? And this is one of the problems with the profession globally, is that we're not really allowing therapists to be compensated appropriately based on increased knowledge, increased experience, or specialization. So as long as we're working in a third-party payer system, we are committed to the contract that we sign. Now, what's interesting is we should acknowledge that while we as therapists want to get paid more per unit and we see declining reimbursement, we need to acknowledge the fact that we're signing this contract, agreeing to the reimbursement rates that we're getting. And there's nothing within this contract that says we're compensated more for advanced education, improved outcomes, or anything related to an improved patient care experience. So the reality is, nothing against new grads. I love new grads, but a new grad coming out of school is getting paid the same amount, the same rate for the same service by CPT code as somebody who has 20 years of experience and a host of clinical education. So what we should be doing is approaching this in two ways. One, either thinking creatively about how we can increase compensation based on increased knowledge and experience, or two, how we would redesign the profession so that perhaps early in our professional career, we are contracted providers, we are working for third-party payers, but then as we advance, we move out of the third-party payer system into the cash pay model. And we're seeing more therapists do this, but I don't think therapists are making the connection that, okay, when I'm a new grad, when I'm just getting started, I'm cutting my teeth, I'm not totally that confident in what I'm doing, I'm going to work for the third-party payer system. But once I've accumulated the experience, the knowledge, the expertise, I'm going to move out of that system because I no longer need to work a minimum wage job.